When I was invited to speak today, I was reflecting on what are the topics that I found specifically interesting for early career researchers that are related to my topic of the Global Health Fellowship. And I thought it is necessary for us to dive deeper in the use of narratives in global health research and education. The postdoc grant that I received was aligned with a project on cancer health literacy in Kenya. And throughout that postdoc, we often focus on what we can learn from narratives in order to use it for research, but also for a variety of educational purposes. And today, I would love to dive deeper into the use of narratives. I'm not going to spend too much time on outcomes. I'm more interested in the processes. If you have any questions later on, please feel free to ask them in the chat box or afterwards. So what do I want to cover today? First, I would love to give you a bit of a background and identify the gap, and then focusing on the potential of using narratives in research and education in general. Then the main part is going to focus on how we use narratives in global health research for cancer health literacy promotion. And there we had different phases where it was all about understanding and exploring the potential, using narratives and recording them, using them for developing a questionnaire, using them in an intervention for cancer patients, but also for healthcare professionals. And finally, I want to share some reflections on the use of narratives in global health research. But let's get started. This research project was addressing one of the main global burdens of disease, which is cancer, which is worldwide often among the top 5, and in Sub-Saharan Africa, increasingly also the second burden of disease. Currently in Kenya, it's estimated that there are about 45,000 new cancer cases. However, if you ask any person around, they will always tell you that they know someone who died of cancer. When we dive deeper and not only look at the epidemiological side, but the social cultural side, then we see that there's a prevailing assumption that cancer is a death sentence. And funeral celebrations are a big social event in Kenya, and often it's announced that someone died of cancer. And there are even urologist speeches on the radio when people talk about someone dying of cancer. So everyone knows that people die of cancer, but people living with cancer are barely known. Moreover, when someone is diagnosed with cancer, then the immediate assumption is, I will die. There's a perceived self-inefficacy, and there's also insufficient cancer health literacy to respond to the diagnosis in any way. Moreover, when we look at the healthcare system, we see that people diagnosed with cancer are more or less pressed into the notion of being a passive patient, a recipient of care. But real accounts of living and surviving with cancer are actually missing. And here, narratives of cancer patients are coming in. Then we look back at narratives in healthcare research. Greenhalgh was commissioned by the WHO in order to look closer into what do we know about narratives in healthcare research. And she came to the conclusion that narrative research are usually present in anthropology, but not in medical textbooks and also not in sociology. One of the first initiators of a change was Arthur Frank, who himself was diagnosed with cancer and other diseases, and he wrote a book, The Wounded Storyteller. And he described that serious illness transforms a person into a patient, which was described as the territory that is colonized by the medical profession and claimed as their own. And it brings a profound sense of loss to the patient. Narrative is a critical tool not merely for coming to terms with that loss, but more fundamentally for resisting entrapment by medical conceptualization and modeling. So he says narratives can have an empowerment approach and resisting. Overall, they concluded that it's needed to have a more humanistic, ethical, holistical, relational, and personal paradigm that allows to surface the voice of the life world, which is then further described as the world at home, family, community, where people become sick, experience fear and hope, and strive to cope, which often contrasts starkly with the narrowly biomedical voice of medicine. And very strong words, but they show who dominates the discussion on cancer patients. And when we look at Kenya, the main discussion comes from the medical field, but not yet from people who are living with that disease. So when we look at narratives and the use of narratives in maybe research, we can look at 4 different disciplines who can have an interest in it. First of all, the narrator itself, the person living with the disease. Then also healthcare professionals, researchers, and other people who are living with the disease or who are newly diagnosed with the disease. And I brought together some selected findings from research, and we can clearly see that the narrator can express their experience, work through it, create meaning, and regain hope and identity based on reviews on narratives in healthcare. Also, the healthcare professionals, they can use these narratives to complement evidence-based medicines and allow shared decision-making. It can increase empathy and can inspire better sharing of the diagnosis. For researchers, apart from recording unique and also shared experience, it's possible to gain a really deep insight into the complex and comprehensive insights into the life of people, identify patterns, and propose policy changes. And lastly, for newly diagnosed people with the disease, they can be encouraged and regain hope. They can prepare for the journey ahead of them. They can get inspired to cope, and they can learn which knowledge, motivation, and competences are actually needed. And by looking at what others do, they can imitate and acquire the competences needed to live with it. So a variety of different potentials, and specifically the last one, the knowledge, motivation, and competences is something we dig deeper. So what kind of competences are needed by cancer patients? On the one hand, narrators allow us to move from being passive to active. And human agency and patient activation requires hope, but also the ability to relate with the information and initiate change. And cancer health literacy is necessary across the entire trajectory from awareness all the way through treatment and recovering. And cancer health literacy is defined as the finding, understanding, embracing, applying, and communicating information related to cancer. So we see narratives could be useful not only for raising awareness, but also for improving competences. So now we were interested in what is happening in Kenya at the moment in order to address the needs of cancer patients. And we saw there are different websites or initiatives that use narratives in order to inform about our lived experience. For instance, the platform Health Experience International, not specifically for Kenya, they report cancer experiences and illnesses. Sometimes cancer patients speak up on radio, on social media. And also there are lots of social support groups who share stories among each other. But they are not reaching the more than 45,000 cancer patients across the country. So there's a huge gap. And one solution to fill this gap is using online pathways to reach cancer patients at home. This could be feasible in Kenya because there's good mobile network and the smartphone penetration is currently at 72%. So we thought that can be a good solution, using narratives to improve cancer health literacy. So we then decided to create a project where we wanted to look at, can we use interventions to improve cancer health literacy among cancer patients and then later also of healthcare professionals. But because there was no intervention available, we first needed to create it ourselves. So we recorded cancer survivor stories, analyzed the narratives, and developed an instrument to assess health literacy. And lastly, because having ideas doesn't mean they need to be applicable to the specific context we are working in, we needed to do a situational analysis in order to explore the potential of using digital narratives. And for the next few minutes, I would love to highlight some of the insights that we gained for these different aspects. Let's start with the situational analysis. Here we had 3 different phases: the scoping review, review of policies, and also qualitative interviews. I want to highlight the findings from the qualitative interviews, semi-structured interviews with a variety of different experts that we identified through purposeful sampling and snowball sampling from NGOs, healthcare providers, and patients. And we did thematic analysis following cohorts. So we were asking what potentials are there for listeners to narrators, and repeatedly they said they can tackle myths that exist in society. They build bridges, they relate to others. They're motivational so that people start regaining hope and initiating change for themselves. They help reflective process, they initiate reflective process about their own realization, but also alternatives. They provide words when you don't have words to speak about. They show how you can act in light of cancer, and they can prepare you for chemotherapy or other things to come. And they address existential questions. Do I have it because I'm cursed, or what is the cause of it? But not only can listening to narrators have a positive potential, also telling it. Many of the cancer patients said it has a therapeutic function for them to express what they've experienced that and come to terms with it. Repeatedly, they said now they can share with others. It's a social function. It created meaning for them to reflect on their work and create a series of coherent experiences. Also, it showed them what they've already accomplished and how they can accomplish it again. It empowered them, and it helped them to reflect that it is a disease that can be overcome. However, there are also certain limitations. Specifically, if people are not prepared, it can be emotionally overwhelming to share a story. If the story is shared in a context where they do not feel safe, it can put extra burden on them. And also inaccurate languages and messages can be shared. So they recommended for a context like Kenya, where not only English and Kiswahili are the main language spoken, but there are also a lot of native languages. It should be at least available in Kiswahili and English. It should be available in video, audio, different formats, across different platforms. We should do credibility checks in terms of what is said and how it is said. And we should be transparent about the recording, because often people expect that someone who spoke on TV or social media, they received a lot of money. So neighbors and family members also expect to get something from the share. So managing expectations and being transparent about it is also necessary in order to not put too much burden on people. And the question is whether you should edit it, or whether people should be well prepared and just sharing what you want them to share or what they want to share. In our case, we decided to go for a fully narrative approach where the narrator himself can decide what they want to say, how they want to say, in which order they want to say it, because we were interested in the way of how they share their story and what is important to them, which will then also resonate with others and which help others to come to terms with the disease. So the next step, after we've identified the potentials, but also some of the limitations, we then went on and recorded narratives. We worked closely together with NGOs, cancer support groups, who could identify cancer survivors who were already able to share their stories. We deliberately said we want to focus on cancer survivors for a variety of reasons, ethical, emotional, etc. And then we went for the two most common cancer types in Kenya. At the moment, it's breast cancer and also prostate cancer. Initially, we wanted to have 20 breast cancer survivors and 20 prostate cancer survivors, but it was utterly difficult to convince prostate cancer survivors or to motivate prostate cancer survivors to participate in that study because, quote, men stay in their closet and they don't want to talk about their health, and specifically not when they're ill. For the analysis, we combined different narrative and thematic analysis, focus on time, place, slot, plot and disruptions, but also the general ones. Here's just one picture of one of the stories. The stories are all available on our website, and we always have it in one language and subtitles in the other language to ensure that everyone can access it. We created a website, Maisha na Cancer website, so My Life or Our Life with Cancer website, where all the information is available and accessible. There's a QR code, but we can also share the link later on. Again, on that website, we wanted to display the stories of the individual cancer patients, always with a short description so that people can relate to maybe someone who is pregnant or someone who has a certain stage of cancer. So to identify and screen who is there. In addition, we also have the audios, and we have also cut it down in phases. So if someone is more interested in symptoms or the diagnosis, they can just look at that specifically, versus others who want to prepare themselves for chemotherapy can go there. When we then try to just sketch out what is a typical cancer patient story in Kenya, there's not a normal start. Some were very proactive and are searching for screening. Some have a strange feeling, and some only go at last minute to go to the doctor. But what all encounter is a challenge in navigating the healthcare system and getting and delivering reports from one place to the other until they finally get the diagnosis. Moreover, the breaking the news, how it is stated, receiving the diagnosis was described by all as a disruptive event, and often oncologists are not prepared to deliver it in a human-centered way, so they're just overwhelmed. Searching for money to finance parts of the treatment is also a main burden for most of the cancer patients before they can finally initiate the treatment. They experience a lot of challenges along the way, specifically a lot of side effects of chemotherapy, and then they're finalizing the treatment, and many move on to support other cancer patients along the way. But this is just more or less the script, the plot. We were far more interested in what are the experiences and how do they describe and how to make meaning of it. We have 40 different experiences, but I'm only highlighting some of the main commonly described aspects because each narrative is unique in itself. So many are frightened to get a diagnosis with cancer because it's considered a death sentence, and some are even left by their partners alone because the partner doesn't want to live with a cancer patient. Some receive a lot of support, so it varies a lot. All of them are really defeated by the diagnosis and struggle to accept it until they prepare for treatment. Social challenges are named a variety of different ways, and many then started to be very selective in whom they relate to and whom not to receive the support they needed. However, along that time, because we talked about with cancer survivors, many of them became actually mentally stronger, and they planned ahead and moved to a stage that they helped others in order to leave something behind, that their disease was not in vain. Now they can help someone else. This gives them a new purpose and meaning. So when we then moved on and said, now we have this database, we have these 40 beautiful cancer stories. Now we would love to see whether actually other cancer survivors or cancer patients can benefit from it. So we wanted to identify a cancer health literacy scale that fits the specific social cultural context, the coping and social structures, and the use of narratives. However, we didn't come up with a single one that fitted, so we needed to develop a new questionnaire. But we were lucky because we already had this really, really rich database of, so to say, pre-evaluated information that cancer survivors shared, knowing these stories are going to be shared with cancer patients. So they selected what is relevant and what is not. And then we followed a procedure inspired by Kelly and Artino, where we just familiarized ourselves with the narratives, identified framework, coded the narratives, developed an item code, consulted experts, adapt and translate, and then pilot tested. So finally, after a long process, a lot of back and forth, we came up with our own cancer health literacy scale for our specific context, which has 4 subdomains: functional cancer health literacy, interactive social cancer health literacy, interactive healthcare cancer health literacy, and critical health literacy. And here's just some examples of the different items that were selected. Overall, there were 26 items because we needed to ensure that cancer patients can fill it in without being burned by themselves. After completed that, we then moved on finally to the step where we wanted to reach, the step where we wanted to see whether this intervention can actually help cancer patients in Kenya. So we started out and we had a pre-test. We shared these cancer survivor stories and we had a post-it. For a variety of reasons, we needed to do it online. However, it also turned out to be a good structure because we can share it with cancer patient support groups, and there were WhatsApp groups with more than 1,000 cancer patients, so they just shared it and we flooded the entire country as such, which was very, very helpful. But besides the cancer patients, our cancer survivors always said, please also inform the nursing and medical students or the healthcare professionals, because they need to know what we encounter so that they are better prepared when they meet a cancer patient and they are showing more empathy and care. We said, let's gonna try it in collaboration with 3 universities in and around Nairobi in Kenya. We could address the third year nursing student, medical students, and could also do a pre-test, engage with narrative posters and focus group discussions. So what are some of the few findings? On the one hand, our very broad first pre-test study we could also use as a feasibility, as a validation study, and there we had more than 800 participants from all across the country, which we were very happy about it. And there we could see that cancer health literacy is rather rare. This scale 0 it's very, very difficult, 4 it's very, very easy. So all said, a lot of the activities they need to perform, it's very difficult for them to perform it. But then over time after it, we see a significant improvement in it. We had about 300 cancer patients that we could identify both time. So engaging with narratives helped. When we now looked at the students in and of itself, we asked them a few additional questions. We adjusted the questionnaire slightly. And initially we saw that nursing students and medical students usually didn't have contact with cancer patients at all. And they are only learning the medical side part to it. Also there we saw that cancer health literacy can increase. We saw a different pattern depending on medical student and nursing students, but we also had a few fewer medical students than nursing students. But what was most important for us was also whether these narratives are useful for them to enhance their empathy and care. And so here are some of the answers from 1 to 4. 4 says it helped them very much. So it really helped them to understand what cancer patients go through, barriers they face, can better emphasize, and they can provide more person-centered care. In the focus group discussions, we asked them about what are some, oh, there's one missing, it's cancer survivors here. And they said, not cancer survivors, medical students and nursing students. And some of them said, and I feel like the narrative is really being a humanistic approach. We are so used to textbooks, definition textbook, ways of like addressing cancer management, and then learning this from lots of people with that experience, it really gives you like a realistic value to cancer as a whole. And repeatedly also said it really helped them, enlightened them, and it gave them a second-hand learning because from the quietness of their home, they could learn it. So what were some of the lessons learned from narratives? For sure, any approach, also narratives, has its shortcomings. Overall, we definitely could see that we could generate rich and deep data on social cultural background, processes in the healthcare system, the struggles, meaning-making processes, and the coping mechanism. It was a really humanized research here because we included the cancer patient experiences. However, the narratives that were told had an audience in mind. We informed the cancer survivors, this is sharing it with other cancer patients so that they learn what you're going through. So most likely, they also biased what they shared in terms of what could be helpful for them. Generally, there's an inherent subjectivity in narratives, and they were presented as survivors. It was linguistically very, very rich because we had Swahili, we had English, and we had a lot of variations. It's quite time-consuming, and the analysis and interpretation highly demanding. There are potential biases involved, but we always did it in collaboration together. All I can say is a big thank you to many of my collaborating partners here. I couldn't name all of them, but I wanted to share some of them, and here are my list of references. And now I've exhausted my time, and I'm very grateful for you giving me the spot to share some of our insights.